The NHS invests around 13.8 billion every year in medications. That's quite a significant figure. Like any investment, we want to get the best return possible. It's very important that patients take medicines correctly to avoid wastage, but also at the same time making sure that they get the best benefits and the best health. Information about medicines is changing all the time, so it's always really important to have the most up-to-date information at your fingertips. For example, parents looking after children. We had a case where the doses of certain children's medicines were changed. It just illustrates that even if you've done something in a particular way for a period of time, that it's quite important to make sure that you've got the most up-to-date information, and the best way to do that is by regularly speaking to your pharmacist.
If I buy them for my children, I read the instructions very carefully.
Some of them you've got to decode a little bit.
I've got 2 young babies and we only ever read what's on the back of the packet, not the actual inside leaflet.
It can potentially be very damaging if you give your children the wrong dosage.
I've got a 2.5-year-old daughter, Lola. A few months ago, she'd been up all night, touching her ear, having the temperature. Took her to the doctors and they actually said it was an ear infection and gave me some antibiotics for it. I ended up going and asking the pharmacist when I actually picked it up for a bit more information, whether I should, whether I shouldn't, and they were really helpful. They kind of sat down for about 10 minutes explaining more than the doctor even did about the antibiotics. The actual instructions in the antibiotics weren't really so helpful because they're kind of applicable to so many different people, ages. It made me feel a bit confused as to when I should be starting, how often I should be giving it, can I give Calpol and Nurofen at the same time if she has a temperature. It's so important as a mother to make sure that you're kind of doing the best for your child, and when it comes to anything medical, you kind of rely on a doctor for their advice, for their help. They'll kind of prescribe something, it's their opinion, and prescribe you with antibiotics when you don't necessarily know whether you want to give it or not. And it's just nice to have the reassurance from someone else as well, because you want to do the best for your child.
I think one of the main solutions to addressing these problems is for patients to be better informed about their medication. Lots of people have access to the internet and to the opinions of their friends or colleagues. It's quite important that patients are able to find out accurate information, and really the best person to do that for them is their pharmacist. We now realise it's important that we tailor the advice that we give to patients on an individual basis.